First, an independent review has found Guernsey needs to improve mental health services for young people and those in crisis. Published today, it also found some patients felt failed by the system. A warning, this report from Faye Rowlands contains references to suicide, which you may find upsetting. We've also changed some of the names to protect people's identities.
When I finally got referred, I'd actually made a suicide attempt. So things were really, really bad. I was rock bottom at this point.
It took another 4 months after that day for Laura to actually see someone within Guernsey's mental health service. When she finally did, she was left shocked.
I said, well, why haven't you done it if you're, feeling this low? And I said, well, because I know how upset my family would be if I were to kill myself. And they said, well, it's not illegal to kill yourself. What's stopping you?
Jamie also had a bad experience when accessing the service for young people locally.
You're just a number, or you're just a letter on a piece of paper that they're trying to get better and tick off. And they're waiting for people to reach crisis point, but you shouldn't have to reach crisis point before you access help. That's what you're trying to prevent.
But others who say they reached that crisis point feel they were turned away. Left without support when feeling suicidal, they didn't want to talk on camera. Concerned going public would impact their future care. A review out today does highlight cases where patients have felt let down by the system. It picks up on the need for more resources for crisis and out-of-hours services. Gaps in services for young people were identified, as well as the need to improve access to mental health services for prisoners. But it does recognise improvements have been made in recent years, saying compared to the UK, overall, Guernsey's service isn't that bad.
There's an enormous amount of support across the island for people, and better actually than you would find in the UK. Certainly. I mean, in the specialist mental health services, for example, there's a range of different psychological therapies people can access. It would be unlikely for them to be able to access those so easily certainly in England anyway. So services are good. My recommendation was better coordination, better working together, more of a partnership approach, which has already started to happen.
Health won't comment on individual cases publicly, but encourages anyone with a complaint to go through the formal process, adding that it's committed to improving and supporting staff to make changes off the back of this latest review. Faye Rowlands, BBC Channel Islands News, Guernsey.